sir, let's start with the elephant in the room. Why do you think TMDs are so misdiagnosed?
Hi Aakash, yes, this is a very relevant question, that why the TMDs are misdiagnosed. You're right, they are misdiagnosed or underdiagnosed at times also. But before I answer your question, let's first discuss what exactly is TMD, because we are using this term TMD so often, and sometimes we use word TMJ also. So TMD stands for, we have this TMDx written here also, it stands for Temporomandibular Joint Disorders. Okay. So that means the joint is coming there, that means it is a joint problem, and temporomandibular joint TMJ is a jaw joint. So basically it is a joint problem, just like any other joint problem in our body. जैसे घुटने में दर्द है या किसी और जॉइंट में प्रॉब्लम है, वैसे ही ये जॉ जॉइंट में प्रॉब्लम है. So that is exactly is the TMD. Now it is misdiagnosed or underdiagnosed because of so many factors. Number one, I would say the varied clinical presentations and overlap of symptoms. For example, अगर आपके घुटने में दर्द है तो आपको यहाँ पे सोरनेस होगा, आपको उठने बैठने चलने में दिक्कत आएगी, विच विल बी, एंड बहुत इजीली किसी को भी समझ आएगा कि मेरे घुटने में दर्द है. यू विल गो और यू विल कंसल्ट ए ऑर्थोपेडिक सर्जन एंड ही कैन diagnose the same thing with multiple tests or investigation, and they can start the treatment. In TMDs, it could be as simple as that also, like कि आपको मुंह खोलने में या चबाने में दर्द है और यहाँ दर्द है, तो can be easily diagnosed, but not all the times. Most of the time you will have a varied kind of symptoms like ringing or tingling in your ears, neck pain, neck stiffness, headaches, different kind of headaches, sinus pain, toothache, neck spasm. Okay, so that's why that varied kind of symptoms are there, so many overlaps of symptoms are there, that makes the diagnosis difficult. That's why it is misdiagnosed, number one reason. And second most common reason, I think, is the lack of awareness among the patients also, and to some extent lack of awareness among the healthcare professional also, which include the dental professional also and the medical professional also.
I think that's a very big gap, because I don't think dental schools right now teach us about TMDs.
Yes.
So maybe you can elaborate on that.
Yes, this is a very valid point. I think there's a lack of training also. So that is there, the lack of awareness among the healthcare professionals, the patients, and the lack of training. That is one more point. And third, one more problematic point here is the psychosocial element, because this joint or this pain is also affected by the psychology of the patient also, which makes the things even more worse. And that we have problems like we don't have specific tools to diagnose. Just like for spine problem, we have MRIs. Gold standard के MRI किया, कौन सा डिस्क में प्रॉब्लम है, you can treat. Here we can do MRI. MRI can give us certain insights into the joint. We can do OPGs and CBCT and other X-rays also, but they are not very specific. Okay, so that is one more problem. And then it is an integrated thing, which multidisciplinary approach is required. So that's why, because of all these factors, the diagnosis is difficult. That's why it is misdiagnosed and underdiagnosed. And as you asked that why there's this gap is there, because now you see this, because as I told you, these symptoms are varied. So if symptom is just like pain, the patient can go directly to an ENT surgeon, because कि उसको यहाँ दर्द है तो उनके लिए कान है. Very simple कि ये कान में, यहाँ दर्द है, कान में दर्द है. That's why we see a lot of times we get referrals from the ENT specialist, because we are the first line of treatment, first line of healthcare worker, or first person to see this should be a dental professional, but people seek ENT help because उनको लगता है कान में दर्द है. Sometimes if there is a headache is there, they start seeing the general practitioners, GPs or the physicians. And similarly sometimes they go to dentist also जब ये problem चबाने में या किसी और दिक्कत में है. But again in dentistry, for people, we are all dentists. You're also dentist, I'm also dentist. But we know that you're a prosthodontist, I'm a maxillofacial surgeon. So that is again one more thing which people are not aware of, that in dentistry also we have so many subspecialties, and in TMJ or TMDs also are treated by different specialties by different approaches. Okay, and every specialist have their you can say expertise and their limitations also. Okay, so that training has to be there कि कहाँ तक जाना है, till where it is my case, and till from where I have to refer this case to a certain other specialty. And people don't know this. उनके लिए dentist है, वो आ गए हमारे पास. अगर वो केस सर्जिकल नहीं है तो maybe probably I have to refer that patient. So that is why one more problem where people keep on bouncing from one doctor to other doctor. So that is one more problem. I think that answers your question that why it is misdiagnosed or underdiagnosed.
Yeah, you rightly said that it is not only the patient factor but also a clinician factor, because of lack of training, dentists themselves don't know where to refer, whom to refer.
Exactly.
Even if a BDS person sees a case of probable TMD case, so he will seek help of maybe an orthodontist or prosthodontist. And if the
Exactly.
person goes to orthodontist, he'll say, let's do just orthodontic corrections or
Yeah.
orthodontic correction.
Correction,
If
yes,
it
yeah.
comes to me like a prosthodontist,
Yeah.
splint zindabad. We'll just
Exactly.
say,
That's why it is causing a lot of frustration among the patients also, and that's why it is poorly diagnosed, and that's why the patient outcome is not good. Patient are not satisfied with the treatment, and then they start becoming like they start doubting everyone. यार ये पहले कर चुका है, ये कुछ बोल रहा है, ये कुछ बोल रहा है. They are not very clear. उनको लगता है कि डॉक्टर को clear है what exactly they are not trying to find the exact cause of my illness. And that's why even in my OPD, I see when patient comes to us, they come with so many of paperwork, because so many files. They have consulted neurologist, ENT, neurosurgeons, dentist, physicians. So, and probably that is the biggest drawback. And that's exactly why we have come out with TMDx.
yeah. So we have a basic idea of what a TMD is and the burning issues associated with it. So if we can start from the base and build upon what this joint is and how this joint is different from other joints, say a knee joint.
Yeah, because ठीक है, it is a joint problem. As I told, it is a joint problem. Then why not to consult an orthopedic surgeon? ना? हम लोग क्या कर रहे हैं यहाँ पे? So yes, this to answer this, I think let's try to compare this joint with the other joint. Like other joints in the body, it is also a synovial joint. Okay, the synovium is there, and then the fluid is there, but it is a diarthrodial joint. And like any other joint, we have a disc here. Disc is like a structure, soft tissue structure between the two articulating surfaces of a joint, which act as a cushion. But slight differences are there. Most like other joints, ये भी एक joint है, they're almost similar structure, but small differences are there. And then one big difference I'll talk about later. So like any other joint, we also have a disc, but here the disc is fibrocartilage. In other joints, we have hyaline cartilage. Fibrocartilage is like more robust, ज़्यादा strong है, because this joint ये बहुत चलता रहता है. हम बात कर रहे हैं, खा रहे हैं, मतलब all the time it is working, so it has to be very robust joint, and a lot of remodeling potentials are there. And then other joints, like they have the hinge motion, like ऐसे घूमता है. This joint has like the hinge and the gliding, कि ये rotate भी करता है, फिर glide भी करता है, तो motion भी थोड़ा सा complex है. And then again it works, there are two, it works in tandem, कि right left दोनों काम करेंगे, तभी jaw खुलेगा, तभी बंद होगा. So they are working in tandem also. So just like any other joint, it is a similar kind of joint, but small variations. And like any other joint, any joint which is governed, or the function is governed by the muscles ही joint को act करवाती है, मतलब उसकी movement करवाती है through the set of ligaments and capsules and the cartilages, your tendons. Similarly, we also have these tendons, ligaments and capsule in this joint also. So any other joint problem, we can have the tendinitis, ligament inflammation, synovitis or the capsulitis, जैसे बाकी joint में होता है, यहाँ भी हो सकता है वो सब चीज़ें, if the physiology is overlooked, और अगर physiological limits are stretched. Like अगर हम knee joint की बात करें, जैसे हमें orthopedic surgeon बोलते हैं कि if your posture is not good, your footwear is not good, or you're obese, okay, lot of forces are there on the knee, तो वो problem करेगा. वैसे ही हम बोलते हैं कि अगर आप कि बहुत ही हार्ड चीज़ें खा रहे हो, या आपके ब्रक्सिज्म है, या कोई ऐसी हैबिट्स हैं कि आप जॉइंट पे बहुत प्रेशर डाल रहे हो, तो उसमें भी दिक्कत आएगी. सो अप टू दीज थिंग्स एवरीथिंग इज सेम, बट व्हाट मेक्स दिस जॉइंट रियली मोर स्पेशल इज this joint, when this joint comes into function, so the biomechanics of this joint, how it becomes different from other joints is, in other joints, if you see the biomechanics of other joints, when you see the joint and the muscles and the ligaments, here also we see the action of the muscles, action of the other structure of the joint and the articulating bones, plus the teeth, set of teeth, occlusion, because occlusion governs you can see the motion of this joint, because occlusion or the teeth contact is sort of an end point for this motion. So they should be in harmony, the end point, the occlusion and the resting position of the condylar head, they should be in harmony. Otherwise, if there is some mismatches there, that can lead to the problem. So the positioning of the teeth, they have certain role to play here. because they are governing this movement of the teeth, of the joint, unlike any other joint in the body. So that's why I think this joint becomes even more special, and that's why the dental profession comes into picture. Okay, that's the main reason, I think. And apart from this, the teeth has two more roles to play here as a protective role for this joint, because teeth we have PDL, periodontal ligament. अगर मैं जैसे आपको बोलूँ कि अगर आप कुछ चीज़ खा रहे हैं, सॉफ्ट खा रहे हैं कुछ भी, और सडनली कोई हार्ड दांत में आ गया, तो आप एकदम छोड़ देते हो उसको, बिकॉज जैसे ही वो एक्स्ट्रा फोर्स आपके दांत पे पड़ती है, तो देयर इज ए पीडीएल लिगामेंट, वो एक ब्रेन को सिग्नल देता है कि भाई दिस इज वेरी हार्ड, इट कैन डैमेज योर टीथ और जॉइंट और समथिंग, तो हम उसको छोड़ देते हैं. सो दैट इज ए प्रोटेक्टिव मैकेनिज्म. अगर वो नहीं होगा, हम तो चने भी चबाते रहेंगे, पत्थर के चने भी चबा देंगे, कुछ भी, तो दैट विल पुट एक्स्ट्रा लोड ऑन योर जॉइंट, इट विल डैमेज योर जॉइंट. सो दैट इज वन प्रोटेक्टिव मैकेनिज्म. सेकंड इज मसल स्प्लिंटिंग. अगर आप बहुत फोर्सेस डाल रहे हैं तो ये मसल अंडरगो स्प्लिंटिंग और स्पाज्म में चली जाती हैं टू प्रोटेक्ट दिस जॉइंट. So that's why we see the muscle spasm also with the TMDs. And when we talk about TMDs, TMDs comprise of the problems or disorders of all the structures of the TMJ joint. Like it could be the muscle spasm, it could be capsulitis, synovitis, or the joint structure degeneration. It could be anything. So it's a set of the whole thing. So this muscle splinting is also protective, but if it is overshot, ultimately it will damage the joint. So that's why I think to answer this question, that how this joint is different and how this joint is special, and why as a dental professional we are taking care of this joint and not mainly the orthopedic specialty which takes care of the other joints of the body. So and that is mainly because I think these teeth are there, and that's they're governing the biomechanics. But having said this, now I come to a very, very important point. It should be very, very clear, and a lot of studies have shown this, because earlier it was thought कि ये दांत ही सब कुछ कर रहे हैं, because it is teeth or occlusion is governing the whole joint. So that's why there was all the treatments and all the investigation, they were focused, and everything was built around on the occlusion, and a lot of orthodontic appliances, prosthodontic appliances were there. But that has changed over a period of time, and a lot of studies have shown this beyond doubt, that occlusion is not the only criteria to cause TMD. It could be a contributory or the perpetuating factor. So the bottom line, I would say, no doubt, as a dental professional, whether I am being a maxillofacial surgeon or an orthodontist or a prosthodontist or a restorative dentist or a general practitioner, we all have the responsibility to treat this patient with TMDs, but we should look this joint orthopedically and not through the lenses of occlusion all the time.
Right. I can already see all the prosthodontists and orthodontists just going berserk on their keyboard कि कैसे बोल दिया ये. But let's just dive deep into it in further episodes, and we'll explain all this. Everything will be evidence based, and we'll bring more guests who are more specialized in this.
Yes, definitely. It has to be multidisciplinary.
Yeah.
Okay, so when I'm saying this, I'm not saying that prosthodontists or orthodontists will not treat TMDs. They will treat. TMD it's a bigger, it's like a bigger terminology. There are so many diseases which is coming under this umbrella.
Yeah.
So जैसे मैं एग्जांपल दूं कि अगर कोई मैकेनिक है ना, तो एक ही स्क्रू ड्राइवर से सारे स्क्रूज नहीं खोल सकता. वो स्क्रू का हेड देखेगा, अकॉर्डिंगली वो अपना स्क्रू ड्राइवर निकालेगा. अगर वो एक ही स्क्रू ड्राइवर से हर स्क्रू को खोलना चाहेगा, तो वो स्क्रू को डैमेज करेगा. सो सेम थिंग कैन हैपन टू द जॉइंट ऑल्सो. So we have to first see that what exactly is the problem. So then if it is a problem related to occlusion, yes, the restorative dentist or the prosthodontist or the orthodontists are the experts. They should handle this. But if there is something wrong inside the joint which needs a surgical intervention, then yes, it is a surgical problem. So
right.
But we have to diagnose.
So the bottom line is the umbrella is so huge that everyone has a space to stand on their own.
Yes.
So sir, we have discussed the problem statement. We have discussed the anatomy, the biomechanics, physiology, etc.
Yes.
Now comes the devil of a topic, that is diagnosis,
yes,
right?
Diagnosis, yes.
So maybe if you can elaborate on that, the problems associated with it, and maybe explain the RDC TMD or DC TMD, which is the supposedly gold standard of this whole criteria. Yeah. So
yes, we have discussed like the complexities of this topic per se, the TMDs, that how complex the signs and symptoms are, that how complex is the anatomy and how complex is the physiology of this joint also. So that's why obviously the diagnosis is not very simple. It is at times difficult to diagnose what exactly is the problem. And to top that, we don't have a specific tools also, as we have discussed earlier. There is no specific test per se कि ये इसको diagnose कर देगा कि this is TMD. So that's why diagnosis become little difficult. And mostly it is basically clinical diagnosis most of the time. You have to be patient and take a thorough history and all the clinical symptoms, examine the patient properly. So that probably will give you a good diagnosis. But yes, it is not that easy, and that's why certain criteria were given, as you told about the RDC TMD criteria, which was thought to be the gold standard earlier. It was the research and diagnosis
Research diagnostic
criteria for the TMDs. I think 1992 it was given, and it has two axes. Okay, one was talking about your physical thing, that is whether the muscle problems are there or the joint problems are there. In joint problem, they further divided whether it's a disc problem or your condylar head problem. Like this, they have divided further it into different criteria. And then axis 2 was talking about the psychosocial element of the TMDs. But it was more of kind of a research-oriented kind of a criteria. So that's why in 2014, I think they revised this. But it is an evidence-based criteria, no doubt about that. So 2014, they further did some, you can say, updated this criteria, and now they call it DCTMD criteria. It is more, you can say, easier to use. And yes, it is one of the criteria which can be used for the TMD diagnosis. But again, having said that, it is not the gold standard. I must say that कि आप इस criteria के हिसाब से diagnose कर सकते हैं, ऐसा नहीं है, because there are certain other criteria also. Now, if you talk about the surgical treatments also, then we have the Wilkes classification, which is taken as a gold standard. And if you see the MRI reporting also at times, they also talk about the Wilkes classification in that is talking about the degenerations inside the joint. And we have the Dimitrilis classification also that tells us what exactly the surgical treatment has to be done. So there are different criteria there. But to make things simpler, I think, it is my personal opinion, or maybe others will also, they will agree with me, that just to simplify things, when we talk about the TMDs, we should divide it into two things. First, it could be a joint problem, or it could be a muscle problem, or it could be a combination of both. Because most of the time when patients come to us, they have the symptoms of both joint problem and muscle problem. And some amount of, or some portion of the patient, they come only with the joint problem and only with the muscle spasms at times also. But mostly the patient comes with combination of both. So to simplify things, I think we can say that we have to check three things in TMDs, that is the pain, the function and the noises. Pain है तो कहाँ है? Joint में है, muscle में है, localized है, diffuse है. Function कैसा है? Mouth opening है कि नहीं है? Mouth opening pain पे कितनी है? Without pain कितनी है? With pain कितनी है? So those factors you have to see. Noises हैं कि नहीं? Clicks हैं कि नहीं? Clicks नहीं है तो क्या पहले history of click is there or not? Crepitation है कि नहीं? So these things, the proper history will lead to a good diagnosis. And in the end, it will be either a joint problem or a muscle problem or combination. In joint problem, again, we can have the systemic joint problem, जैसे rheumatoid arthritis भी हो सकता है, जैसे बाकी joint को affect करता है, it can affect our TMJ also, but rare as compared to the other joints, as it is affected by the rheumatoid arthritis. We can have the osteoarthritis, just like the knee joint. We can have the chondromatosis, etc. We can have the capsulitis, synovitis, or systemic other systemic problems. We can have some tumors also. We can have dislocations also. So all set of problems which are related to, like जो भी joint का structure है, वो चाहे दो bones हैं जो आपस में घूम रही हैं, चाहे disc है बीच की, या disc के ligaments हैं, या synovium है, या capsule है, anything going wrong with all this structure, that is the joint problem. That could be systemic, due to trauma, due to overuse, due to physiological problems, या biomechanics गड़बड़ है, because of anything. So that is the joint problem, कि joint के अंदर गड़बड़ है. And one is the muscle problem, कि अगर आपने overload किया है joint को, तो then muscle will try to protect the joint, so they'll go into splinting or spasm, as we have discussed earlier. So then they can start having other muscle problems also. So then we can have the fibromyalgia also. So they are the muscle problem. And most of the time, as I told, it could be a combination, because we don't know how it started. That's why it is very important to see, along with the diagnosis, to see the cause.
Yeah.
शुरू कैसे हुआ? So it could be that प्रॉब्लम कुछ भी हुआ, चाहे ऑक्लूजन से या किसी और चीज़ से, ओवर यूज से, उससे मसल स्प्लिंटिंग हुई. ओवरऑल उस मसल स्प्लिंटिंग को हमने ठीक ही नहीं किया, हमने चीज़ों को करेक्ट ही नहीं किया, तो धीरे धीरे उसने जॉइंट को भी अफेक्ट कर दिया. और इट कुड बी ए जॉइंट प्रॉब्लम टू स्टार्ट विद, कि कोई ट्रॉमा हुआ, ठीक है, चाहे चोट लग गई खेलते खेलते, बहुत ज़ोर से मुंह खोला, सडनली पॉप हुआ, डिस्क स्लिप हुई, जॉइंट में प्रॉब्लम रही, और धीरे धीरे जॉइंट की प्रॉब्लम की वजह से मसल स्पैज़म में गई, एंड देन लीड टू दी मसल स्पेसिसिटी और प्रॉब्लम. सो इट कुड बी बोथ द थिंग्स, चिकन एंड hen स्टोरी, कि कौन पहले आया. इट्स लिटिल डिफिकल्ट, बट टू सिंप्लीफाई और टू समराइज, आई थिंक we have to diagnose whether it's a joint problem or a muscle problem or both, and if both, then which led to which, so that and what are the causative factors. If we can sort out these certain things, I think that will make our life much easier to treat these problems. And as far as the psychological aspect is there, I think it is again prudent that we should have certain we can say criterias to see that how the patient is progressing. Like we can have certain scores. The most important score which I use in my practice is the JFLS score, that is jaw function limitation score. So here we give some scores कि patient को हार्ट च्यू करने पे, हंसने पे, पानी पीने पे, ऐसे different scores we give कि कितना problem होता है, और वैसे ही वास पेन का स्कोर हम दे सकते हैं. So that when the patient comes on the next appointments, on the recall visits, we can take these scores again and we can show the patient whether he or she is improving or not, and that gives a kind of a biofeedback mechanism. So that is also works wonderfully well in the treatment of TMDs. So I think in the diagnosis part, if we can do these simpler things, just do the proper history taking and just try to see whether it's a joint muscle problem, what are the causative factor, and how the patient is behaving in a set period of time. So it will give us a good diagnosis.
So from what I can understand is, we have certain diagnostic criteria, but they are too researchy, if I can say that.
Yes.
They're so research oriented that they don't consider the clinical aspect of it. Maybe they try to consider, but they're not helping in any way. Or in some way.
Yeah, you can say so.
So for the audience, I will just attach all these documents, RDC, DC criteria. They can learn about that. And maybe if some of you have any expertise on this topic, they can chime in.
Yeah,
right?
Because that's what we said initially also in our first introductory podcast also, because it's a very, very dynamic topic and very dicey topic to say, or it's a lot of gray areas. So we cannot say that we are the experts in TMDs. Nobody is. I think that's a lot of research is happening. And that's why a lot of misdiagnosis is there and patients are not satisfied. So that's why if anybody is doing a good evidence-based work on this, that is the whole idea. Actually, there is the whole idea that everybody should chip in, and we should come to certain conclusion, easier protocols which are more friendly, which are clinical, which are easily can be used in the clinical setups, and gives us good outcomes also.
So we have already discussed about the diagnosis. Let's also pitch in on the treatment options that are available. So if you can shed some light on those also.
See, as we have discussed the diagnosis, we know that it is like how difficult it is to diagnose. But once you have the good diagnosis, the treatment will be mostly straightforward. And yes, it will be multidisciplinary treatment, because we know that the problem is so complex. So we need different specialties to come in. And that's why the diagnosis is very important. So we should know our roles. And so it is very important for us to see what exactly is the problem, just like I said, whether it's a muscle or a joint problem or both, and then what are the causative factors. So that will give us the idea how to go about the treatment part. And just to tell you that various kind of treatment options we have, so it could be as naive as just the counseling part and the home remedies, or just to tell the patient good posture and all those things. Then we have the pharmacological part of the treatment, where we give the painkillers, muscle relaxants, or sometimes the antidepressants also are tried here. So some other drugs are also given. And then we have these appliances, the prosthetic appliances or the orthodontic appliances are there. And then we have the surgical treatments like the lavage, arthrocentesis, or the arthroscopy now, level 1, 2, and 3. And then we have the open joint surgeries and the total joint replacement, that is the TJR. So there are different treatment modalities which are available. But as I told you earlier also, that screwdriver thing, that कि एक ही screwdriver से सब कुछ नहीं हो सकता है. So we have to diagnose first, and then accordingly we have to choose a good treatment and a particular treatment option. And as we told earlier, that we cannot treat all the joint problem through occlusion, but at the same time we cannot treat all the joint problem through surgery also. Okay? So there has to be a proper diagnosis, and then the interdisciplinary approach, the good referrals, and it should be evidence based. So
there are other things also. We are talking about occlusion and surgery part, because sir is oral surgeon and I am prosthodontist. So these are just two lenses. There are where it lenses,
because we have the role of psychologist also, we have the role of physiotherapist also. So it is like integrated. So we have to. It will vary from patient to patient. The first thing is proper diagnosis and the causative factors, and then we come to the treatment part. And as I told you, then we have to have a good, you can say certain criteria is also to check that how the patient is responding to the treatment, to get that biofeedback mechanism also happening there. So that is also a very important part of the treatment modality.
So to conclude, it is about finding what is there, right?
Yeah.
Finding X.
Yes.
So that's why we started TMDx, right?
Yeah. Yeah.
So TMDx is Temporomandibular Disorder Exchange, where you can pitch in ideas,
Yes,
discuss
yes.
about all the anomalies that we have in our joint, and maybe general information or doubts, queries, anything.
Yes. Because I'm not saying, or maybe you're also not saying that we are the so-called experts in TMDs, because we are treating TMDs patient and we are seeing our set of problems. Sometimes we, in spite of all our best of the efforts, we are not getting the desired outcome because maybe we have missed something, and maybe that's why the research is required, and that's why we need to have all the experts who are doing good work, evidence-based work on this particular disorder to come in. And I was searching the internet also. I couldn't find much of these kind of platforms. Platforms are there, surgical platforms are there, n number of platforms who are talking about good surgical outcomes, and they're teaching us about the scopies and joint replacements and all those things. Similarly, we have very good platforms on the prosthetic communities also, who are doing different kind of very good work. But I think what we lack is the interdisciplinary approach, the integrated approach, where we have to sit together and discuss, and we have to find certain protocols, and that's why I think the patient outcome will be better, and we'll have better protocols to treat TMDs.
Right.
So
As
in
we-
this, yes.
Yeah, as we said, the umbrella is so huge that everyone has a place to stand on their own,
Yeah,
right?
yeah.
So
So in this TMDx, that's what we are planning. Like we are like open to the suggestions from our senior colleagues or the other experts from all these specialties who are doing this kind of good work. So we should all join hands and just see where we can go from here. And we plan to do like a different case discussion podcast or similar this kind of discussion with other specialties also, some debates also at times. We can have some you can say
constructive criticisms.
criticism also. So, and we can do offline courses also to train young clinicians also to different aspects of the TMD management and diagnosis. So that's all in the agenda, but we don't know how it is going to be in the future. So it all depends upon it, how we
this
get the
goes.
reaction and how we go from here. So let's hope that
This is just a drop in the ocean,
yes,
and
yes. So
let's see.
Let's
if we
hope that
can-
it becomes a good community which works on the evidence based, and it is for the science, for the betterment of science, and we all grow from here, and we fulfill our responsibility toward the population to treat them, and that's it. Yeah.
That's it, sir. Let's shake hand on that.
Yeah,
Then
thank you.
let's start this
Yeah,
and
sure.
build this community.
Thank you.
We welcome all of you on board, and let's start a very fruitful discussion. Thank you so much, sir.
Thank you, Aakash. Thank you.